Hello, my name is Paul Wrezel, and I'm from Regis Technologies in Chicagoland. My presentation today is Selected Case Studies and Impurity Strategies for Drug Substances. This is actually a representation of what I gave at Pittcon 2015. The outline for my talk today will cover impurity thresholds, potentially genotoxic impurities, also known as PGIs, phase-appropriateness of specifications, what we see at Regis, as in case studies, and concluding remarks. I'd like to make a couple of comments. First, that the scope of this talk will be drug substances, but many of the principles can be applied to drug products as well. The other comment is that a recurring theme through this will be specifications, which is a very important term because it denotes the limits of acceptance or rejection of a material. So for my first topic, I'm going to cover impurity limits. And the ICH guidelines is a great way to start. They're written for commercial products, but they're often applied to drug substances even earlier in a project as well, such as pre-commercial. Regis is a contract lab, and Regis has a contract lab that supports manufacturing. And we see a lot of customers with many preferences. And some of these customers use the ICH as an inspiration where they'll want their specifications as strict as the commercial guidelines or something less stringent. In either case, these guidelines influence specifications. The guideline known as Q3AR2 has a table in it which covers reporting, ID, and qualification thresholds for maximum daily doses in two different ranges. And obviously, for the higher dosing per day, your thresholds will be more stringent. A number that's often used in conversations is 0.1% limit of impurity for identification, because what happens is that if impurities are greater than this amount, it may be necessary to do extensive work in terms of identification, purification, and qualification in toxicology studies. These impurities typically pertain to the category of impurities known as related substances, which are in turn usually analyzed through chromatographic methods such as HPLC and GC. Sometimes these impurities are now referred to as traditional or non-mutagenic impurities in the context of my next topic, which are the PGIs. This designation is based on structural groups of toxicological concern, or mutagenicity. Mutagenicity will lead to thoughts of whether or not a compound might be carcinogenic as well. There are regulatory guidelines available, which I will present shortly. The class of impurities known as PGIs typically prompts the need for testing with greater sensitivity because of the risks involved. There are softwares available that actually examine structure-activity relationships of compounds when you input structure. And these are great tools for predicting toxicology, especially in terms of potential genotoxicity. One can watch out for big flags like sulfonate esters, anilines, and certain other alert groups. And in any case, determining limits is challenging. Let me show a few tables that will help walk us through this. This first table comes from the FDA guidance, and it shows a relationship between duration of dosing and the amount of impurity that's permitted per day. So going from left to right, the scale goes from short-term dosing to long-term dosing. And I think it makes intuitive sense that as you dose for longer periods of time, the amount of impurity allowed per day would be less and less. This other table is a little busier, but the intention is to just show a few general concepts. It comes from an ICH guideline known as M7, and it categorizes impurities in terms of most of concern, you might say, as in class 1 down to class 5, which is your more or less non-mutagenic or traditional impurity. This might be a simplification, but think of if caffeine was an impurity in your drug substance, it might be like a class 5. Whereas something like nitrosoguanidine might be something of a more severe class of lower number. So how you actually define what class is your drug, or excuse me, your impurity in your drug, is a topic for deep discussion, and it's not going to be covered here, but I wanted to make people aware that this information is available. So for my next topic, I would like to talk about phase-appropriateness of specifications for impurity levels. So how do you set specifications? And you certainly will use the ICH guidelines as your means for determining specs at commercial stage or even late stage of your project. But organizations that have their act together on impurities and policies will typically have guidelines to cover what is permitted at preclinical and early clinical phases. It's very important that regardless of how you set those specs, you still need to be covered by toxicology qualification data prior to giving any of your drug, and hence impurities in humans. What are possible related substances? Well, there should be an impurity strategy throughout development, and one wants to consider all synthesis, byproduct, and degradation pathways. So what should really be happening in one's project is that all your think tanks, all the talented people in the organization, from chemistry, from regulatory, whoever is knowledgeable about what might be formed during synthesis or degradation, should consider what would your impurity list be. That list could be very large if you start to think of all possibilities. And that's fine, because you could always eliminate things as the project moves forward. What would be a real problem is if you were a deer in the headlights and weren't expecting anything, and then you would be in a surprise mode, and that's never a good thing. Why is that important in turn is that you have knowledge of what might be formed as impurities, so that when impurities actually show up in analyses and there's a need for identification, you have a head start. Impurity specifications tend to be liberal at preclinical and early phases, and they evolve to more stringent by the time you get to commercial phase. I think that's obvious, but it's a point to stress. And of course, the analytical testing rigor relates to that stringency of specifications. What I'd like to now do is go into some case studies, and we have 4 of them that I'm going to cover. The first of these regards 4-aminopyridine. This compound is actually a drug substance from which Regis owns the drug master file. And as we were working on this project, the regulatory agency became aware of impurities that were known to possibly be formed in the synthesis. And what was really happening is that as our project was evolving in development, the industry was also evolving in concern over potentially genotoxic impurities. So that somewhere in the middle of this registration exercise, the FDA actually said that although there are 2 impurities here, although they were formed in some early lots, our synthesis knowledge enabled us to eliminate them, and we were always able to make material then subsequently where those impurities would be present at less than 0.1%, which was excellent. However, the agency flagged these 2 impurities as potentially genotoxic, and it was upon Regis to come up with an assay that was significantly more sensitive than the typical 0.1 spec or a 0.05% limit of quantitation. Again, this is due to alerting structural components. Also importantly, from what I understand, the agency probably used some of that software that I talked about in a previous slide to determine whether or not these might be of toxicological concern. And so what Regis did was we analyzed representative lots, we analyzed validation lots, and showed that these were not detected at the new target level. Ultimately, the story ended where we did not actually have to test for these impurities anymore, because we showed through diligence and good analytical work that these impurities were less than even the lower limit that was put upon us to determine. Our second case study is about hydrazine. Now, hydrazine is a reagent that's used in a lot of syntheses. And interestingly, in the last couple of years, around 3 or 4 of our customers have given us projects that somehow involved hydrazine. And of course, this is a compound you don't want to have in your final drug substance. I am not completely sure if this is considered a PGI, and yet I do know, at least empirically, it's something that the customers do not want to have in their materials. So hydrazine is the kind of impurity which has a poor chromophore, but one can derivatize it very efficiently and analyze it by chromatographic methods, either HPLC or GC. This is the reaction showing benzaldehyde plus hydrazine forming the benzazolene derivative. And in this next slide, we show that the derivatization is rapid, and it happens 5 minutes or faster. Again, hydrazine is a poor chromophore, but with the benzaldehyde derivative, it's actually quite chromophoric, and you could detect it at 300 nanometers, which also in HPLC terms takes you out of the weeds from other impurities. So it's great for specificity. Of course, the strategy is that you derivatize hydrazine standard and quantitate your samples, which are also derivatized, where the hydrazine impurity, if present, will derivatize. And so you have a weight percent assay that you can use. In the case of hydrazine, one could actually purchase the derivative, so you could look at the method from either mode, using either the pre-derivatized standard or making your own derivatized standard. The HPLC development in our case was never very challenging. It's seen that reverse phase, stationary phase columns could easily separate reagent, derivative, and sample-related components among the several projects that we had done this for. So again, speaking in general terms, our sensitivity was somewhere between 5 and 100 ppm for the projects we got involved in. And spike recovery, which is something you always do need to check, was greater than 90%. In some cases, by the way, we validated such methods. Here is a series of panel overlays showing from top to bottom a diluting agent blank, a derivatized blank, a sensitivity standard, an assay standard, as well as a sample that contained no detectable hydrazine. So moving on to my third case study, it's about a compound called Azide, and its story is very similar to that of hydrazine, where it's a reagent and it could be a problem if present in your material, and it is known to have toxicity. To my knowledge, it is not specified in any PGI guidelines, but as said for hydrazine, our customers do not want this in their materials. So much like hydrazine, this compound can be derivatized. On this slide, we show the derivatizing agent reacting with azide to form the derivative. The derivatizing agent is known as pentafluorobenzobromide, or PFBB. And while azide might have a poor to questionable chromophore, it also has issues with typically eluting near the void, and it's really hard to develop specific methods without interferences. Derivatization in this case takes about 8 hours, and that's really not a concern because the assay is very practical. One could start the derivatization on a given workday, let it even sit overnight, and there seems to be no analyte stability issues with it going longer, where you'd have breakdown products as such. So it's fairly robust for the projects we've worked on. By the way, the extent of derivatization was verified independently via NMR techniques. The strategy, of course, is to take azide and make a standard from it and derivatize it, and then of course you take your sample material, and if any azide is present as an impurity in that, it would be derivatized and you have a weight percent test. The method development, although I'm not going to go into great detail, was a lot more challenging in that our typical C18 and C8 phases were not amenable to separation of the derivative from the reagent. And a phenylhexyl column was however, very good in making that separation. Maybe not a real big surprise if you think about the structures and knowing how these particular stationary phases work. I'll have an example chromatogram shortly, but I wanted to just show some highlights for a particular proprietary compound. We call it number A, or letter A. We had a 50 ppm azide quantitation limit, a 6 ppm detection limit. Our range was fairly wide at 50 to 1,000 ppm. Spike recovery studies across that range of ppm were in the 90s to 101%, which is excellent. Injection precision was, again, really good. And we had a spectrally pure derivative peak. And we did this for several compounds. And a set of example chromatograms is shown here, where we have a DMSO blank, that was our diluting agent, as well as a derivatized blank, and then a derivatized standard. So the peak that's coming out in this case around 22.6 minutes is our derivative. And my last case study is a more generalized theme, and it's about impurity lot history and pattern recognition. It's very important to understand impurity history for relevant drug substance lots. And it's very important to compare lots in a single run to evaluate similarity in retention time, UV spectra, mass spectra, and so on. So let me put this in more real terms. Let's say that a project is starting and the first lot is made and release testing is performed. HPLC analysis shows that there's one impurity with relative retention time, 1.10, and it happens to be present at 0.2%. Well, okay. So the next lot you make has an impurity present at RRT 1.13. And the question is whether or not that impurity is the same in the second lot as in the first lot. Someone might jump to conclusions and say, well, when you round all the numbers of relative retention time, yeah, it's the same. And actually, that would really be a very risky thing to do. And it's very easy, however, to do a comparative analysis or a cumulative analysis of lots throughout a project lifetime. And this way you can look for sameness in terms of retention time, UV spectra, and mass spectra, and all those things. I'm going to show some examples shortly. I always like to mention that impurity qualification is critical, to not forget that even if you show sameness of an impurity, you want to think about qualification, and if you've got the right limits or right amounts qualified in tox studies for a given impurity. Keep in mind also that changes in impurity profiles happen as you go from early enabling routes to more finalized manufacturing routes. Be vigilant that changes in routes and workup, salts, solid states can impact profiles. Doing this impurity lot history will certainly help track how you're improving the process, and it also helps to justify specifications throughout the program. So this is the slide that exemplifies what I was talking about in this case study. I entitled it Pattern Recognition, and what we're doing here is looking for sameness of UV spectra and mass spectral characteristics. It's not my intention that every detail of this slide is readable, but what I wanted to point out were a few features. The columns represent impurities denoted by a nominal retention time. And in a given table, the rows, at least on the top half, represent manufacturing lots. The bottom halves of each table represent challenge questions, such as are the spectra the same, and so on. So let me give an example. I will use my pointer, but I'll also try to explain where I'm pointing in case this is not visible to the viewers. So in the left table, second row, we have toxicology lot. And we see percent abundances of impurities. The one I'm going to single out is this second from the last column, which says 0.50%. That is the amount of impurity in the toxicology lot. And what we have seen in subsequent lots, which are in the fourth and fifth rows, are the impurities of similar retention time, and then the question is whether or not those impurities are the same as what was in the tox lot? Well, by running a cumulative analysis where everything's run in the same analysis, one can look at the UV spectra and the mass spectra of the impurity and ask whether or not there is a matchup between those impurities in the different lots. And in the case of this particular impurity that I singled out, we see that yes, there actually is a matching. Again, the details aren't critical, but it's important to note that when the plant lot number 3 came out with an impurity at 0.2% and at 0.1% in the subsequent lot, that the toxicology study covered or qualified this impurity, and it basically covered that impurity for the later 2 lots. So for the last thing, I'd like to make some concluding comments. I think it's important to understand your guidelines for ICH, from ICH, as well as your PGI guidelines, as well as in the context of drug development phase to set your specifications. Be aware of alerting structures that may have high toxicity or genotoxicity. Also, it's very important that one has an impurity strategy that covers the entire drug development. Speculate on possible impurities through chemistry knowledge, and maintain an impurities versus lot database throughout the project lifetime. Last, I would like to acknowledge the analytical method development team at Regis, as well as Marlon and Igor here at Regis, who helped a lot with the derivatization work. And with that, I'd like to thank you for your time and attention.